session with me. In today's session, we will be discussing about a topic which is from Unit 2, and that is Under 5 Clinic. So let us see first what we mean by Under 5 Clinic. So basically, Under 5 Clinic is a center where preventive, promotive, curative, referral, and educational services are provided in a package to under 5 children under one roof. So basically, this clinic is a center where, which is basically designed for under 5 children, and in this clinic, there are several services, which is provided to these under 5 children. So under 5 clinic does not focus on a specific aspect. It is a center where all the aspects of care are provided. So, for example, like preventive, promotive, curative, and referral and educational services. So all these aspects are seen, and all these services are provided to under 5 children. And these services are basically provided through trained nurses. So it is something that these services. So the goal is here that they want to make it available for larger population of the country. So that's the reason we have to learn about this clinic, and as a nurse, you have a major role in this under 5 clinic. But before going deep into under 5 clinic, first let us understand why it is important for why this age group is important. That is, we are talking about under 5 children. So children who is below 5. Why it is important for them to have these services, or why it is important that there should be a clinic which can provide these services to particularly this age group. So we can say that this under 5 age group, or this age group is a special group. Why? Because they constitute about 15% of the population. So they are large in number, and we can see that there is a larger percentage in the total population, right? So that is why they are considered as a special group. And again, if we see the mortality and morbidity rates of the country, they suffer from high rates of mortality and morbidity. So we can say that the mortality and morbidities are more prevalent in this particular age group. So if we want to reduce the mortality rates or the morbidity rates of the country, then definitely we have to take care of this particular age group. And then if in this age group they are malnourished, they don't get enough nutrition, and if they acquire certain disorders, that would have an effect in their later life. So and definitely we have to make sure that in this age group they should have proper nutrition. They should not be malnourished, they should not be undernourished, and they should not acquire any kind of disorders such as nutritional disorders or any diseases which can be prevented. And again, if you see the statistics, that is the mortality and morbidity rates of the country, we can see, and the causes behind that. It shows that most of the causes, most of the diseases are preventable, but but we have to adopt certain interventions for that. Well, the next thing is that we already know that this is a period of growth and development. So most of the growth and development occurs in this particular age group, right? Yes. So as we have already discussed, about growth and development, we know that. So as we have already discussed about growth and development, we know that this in this age group particularly, the most of the growth and development occurs. So if there is any kind of a deviation or any kind of abnormalities in this age group, then there will be abnormalities in growth and development also. There will be delay in growth and development. So to prevent that, definitely we have to make sure that we provide adequate care to under 5 age group. Next, when we are talking about growth and development, we know that most of the brain development that occurs. And when we are talking about growth and development, and while talking about growth and development, we have to say that the brain growth that is completed in the first 1 year. So if during this stage, if the child does not get adequate nutrition, or the child acquire certain diseases, so that might happen with the growth of brain. So that is again one more reason why this age group is a special group. And also we can say, and also we can see that health of these under 5 children are very much connected to the health of the family. So to have a healthy family, the first thing that we should take care of, we have to make sure that there is a healthy child in the family. So these are some of the reasons, we can say, why the under 5 age group is considered as a special group, and why we are more concerned towards this group. So by now we know that what is under 5 clinic. So this is a center where basically we provide all the services to under 5 children, right? And we know why we are more concerned towards this group. But what is our goal of through this under 5 clinic? So if we talk about the overall goal of under 5 clinic, it is to provide comprehensive healthcare to young children in a specialized facility. So that is the overall goal here. So basically, in under 5 clinic, we are concerned about the under 5 age group. So the overall goal is that to provide a comprehensive care. As I told you that it's the services are provided as in a package manner, right? So they will provide comprehensive care to young children, but in a specialized facility. So that is the overall goal. Now, the next thing is that the under 5 clinic is basically represented by a traditional logo. So we have a logo which represents under 5 clinic. So let's have a look on the logo. Now it is very important to remember it and to understand what it refers to. So here, as we can see in the picture, that we have a triangle, and inside that there are 3 triangles and one inverted triangle. So basically we have one triangle, and inside that there are 4 triangles, we can say. But among those 4 triangles, 3 triangles are it's in a proper manner, and one triangle which is in the center, that is inverted. So this is what the logo of under 5 clinic, right? So at the top of the triangle, we can see it's written health education. So let us see what are those. So the first internal triangle, we can see it's written care in illness. So this is a component of under 5 clinic, that is care in illness. On the right hand side, it is written preventive care inside the triangle, and then on the left hand side, it is written growth monitoring, and the inside the inverted triangle, it is written family planning. So these are the components which is written inside the triangle. Now if we take a look on the the outer aspect of the triangle, we can see that at top of the triangle it is written health education. So that is also one component of under 5 clinic. So these are the 5 components of under 5 clinic, and in this logo it is very important for you to remember this logo with the components, because this is what refers to under 5 clinic. Now we saw that there are different components, right? In the logo itself, it is there are several components written. Now, what do we mean by those components? We have seen that there is care and illness, there is health education, family planning, growth monitoring, preventive care, right? But how it is related to under 5 clinic? So let us see that. So the first thing that we are going to see is care in illness. Now, this is the first and foremost reason we can say for what we take the child to the clinic, right? So any parents or any family members, when the child is not well, when the child is sick, or during any kind of illness, we can say illness is the major reason for what we take the child to clinic. So there are several usual illness that we can see in under 5 children. For example, fever, diarrhea, acute respiratory infections. Then there is infection of the skin. So these are very common in under 5 children. So it is very important that when the child is sick, during any kind of illness, the child should be provided with adequate care. So this under 5 clinic, what they do is basically, when the child is sick, when there is any kind of illness and the child is brought to clinic, they basically treat or they take care of the child during the illness. So that is what is this component. Now there are several care for children during illness which is provided in under 5 clinic. So what are those? Let us see that. Now, they diagnose several diseases. It can be an acute illness, it can be a chronic illness, or whether it is whether it is delay in growth and development. The diagnosis is that is one service which is provided in the clinic. And after diagnosis, definitely the next step is providing treatment. So this is the one thing, this is the one care which is provided in the clinic, that is diagnosis and treatment. And the next one is X-ray and lab services. So this clinic does not only focus on diagnosis and then providing treatment, but they also have the lab services, laboratory services. So that to diagnose any disease or any kind of illness, so many times what happens due to lack of this investigative so many times what happens when there is a lack in the investigative equipment and the resources of those equipment, what happens is we cannot diagnose many diseases properly, right? So for that, here in under 5 clinic, they have their x-ray and their laboratory services also. And then when there is a major disease, or there is not much facility in the clinic, and they cannot take care, they cannot and then when there is a major disease, or there are certain diseases which cannot be managed in a in a small facility, so for that we need advanced technologies, advanced equipments. So at that time we need to refer the child. So under 5 clinic has their referral services also. So they take care of this aspect also, where if the child is not treated in the clinic, and the child cannot be treated in the clinic, they can transfer the child to another facility, or they can refer the child to another facility. So these are the three major care that is provided to the children in under 5 clinic during their illness. The next one is growth monitoring. Now, monitoring growth is a vital point here. And as we said earlier that during this age group, so if there is any kind of delay in growth and development, and any kind of abnormal growth or abnormal development, for that, to assess that, we need to monitor their growth and development, whether they are achieving their milestones according to their age or not. So monitoring growth is very important to assess if there is any kind of abnormalities present. Now, when we are talking about growth and development, there is something, one aspect which comes along, that is adequate nutrition. So, adequate nutrition is vital for growth and development. And if we see this particular age group, that is under 5, we can see that most of the nutritional disorders, whether it is protein energy malnutrition or any of the nutritional disorders, we can see that is more prevalent in this age group. So most of the nutritional disorders occurs in this age group. So as a health worker, as a nurse, it is your responsibility that you have to ensure that there is adequate breastfeeding, weaning, and balanced diet. So this should be followed. And as a health worker, it is your responsibility to ensure that these things are happening properly. So apart from this, you also need to monitor, right? Now, coming to its monitoring part, where you will monitor their growth. So you are going to monitor their growth chart. We are going to have a growth chart where we can see that how the growth and development is taking place according to their age. So for that, what they do is basically they check the weight of the child periodically. So during the first year, every month they check the weight of the child, and then from 1 to 3 years of age they check the weight once in 2 months, and in fourth and fifth years they check the weight of the child every once in every 3 months. So this is how they check the weight of the child periodically to see that whether the child is gaining weight or not according to their age. And besides checking their weight, they also measure their height, the mid arm circumference. So the anthropometric measurements, basically, these things are also done to check, the if there is any kind of delay in growth and development. And then this growth is plotted on the growth chart. So you're going to have a growth chart for each child, and we when we are checking the weight every month, we are going to have a growth chart for each child, and when we check their weight every month, we are going to plot the that number in the growth chart. So we can see if there is any deviation or flattering growth, or there is any curve which is which shows that there is the growth is there is flattering growth, that can be detected very easily through this growth chart, and also suitable action can be taken. And along with these, the milestones are also recorded, based on their age. When they are achieving the milestones, that is also recorded, and if there is any deviation in those things, if there is any deviation in the milestones, the child fails to achieve the milestones at the specific age, that is also recorded. So this is what is the next component, that is growth monitoring. Now next we have preventive care. So by preventive care, you know that preventing any illness, preventing any disease. So for prevention, what we do, the most basic, the most important thing we can say in preventive care is primarily the immunization. So this preventive care involves primarily it involves the immunization services to first 5 years of life. So during this age group, under 5, we there are several there is an immunization program through which they provide several immunization to the child. So basically, they get a vitamin A supplementation, iron supplementation, and anti-helminthic treatment. So these things can prevent many diseases, right? So vitamin A supplement is given to prevent blindness, and then they give iron supplementation to prevent anemia. So these supplementations or care, these are provided to prevent certain diseases. So as we were when we were discussing about why this under 5 children is a special group, we were saying that if we see the causes of mortality and morbidity rates, we can see that most of the causes are preventable. Most of the diseases or illness are preventable. So for that, the action which is being taken by under 5 clinic is to provide immunization to prevent certain diseases and to provide the supplementation to prevent these disorders. And in this and also in this preventive care, they provide regular health checkup, usage of oral rehydration therapy during diarrhea, so that we can prevent dehydration in the child. And with that, as according to their age, the as we have the immunization program based on that, according to their age we provide the vaccines also. So this is what is preventive care. So through this preventive care, there are these services which are provided to under 5 children. Now the next component is family planning. So when there is any program which is directed to women and children, which is for specially designed for women and children, we can say that family planning is a central part of that program, because this has an impact on the health of the mother and the child. So that's the reason in this under 5 clinic the mothers are counseled on the various options available for family planning. So they are not only given with the options, but they are also explained with the the merits and demerits of specific options, so that they can make a choice. And then we have health education. So health education is a major part. As we know that as a nurse, we have a major role in educating the people, right? So here you need to educate the mother on issues of children. What are the common illness that might that occurs to children and how it can be prevented. Then about breastfeeding, and nutrition, and also the growth monitoring. And then you also have to encourage the mother. You have to educate them that what is the importance of immunization, how it helps to prevent major diseases. And then there is a very important part which is about hygiene. So with that, how they can avoid infection. So hygiene of safe water, and when they are preparing food for the child, how they should maintain their what all hygienic measures they should take. So this is what we mean by health education. So this is what they do in health education. So these are the 5 components of the logo that we saw earlier, and this is how it is related to under 5 clinic. These are the services that they provide in under 5 clinic. Now the next one is nurse's role. So we already know that in under 5 clinic, what are the things that we are expected to do, and what is our role there. But let us see that specifically what are the now we already know that what this under 5 clinic is, what is their main goal. But let us see, as a nurse, what is our role, what is the nurse's roles and responsibilities. So the first thing is that you have to give warm welcome to the mothers and the children. So whenever they come to the clinic, you should give them a warm welcome, so that they feel familiar with the environment, and you would be able to build a relationship with them. And then providing immunization services. You also have to maintain the growth chart, immunization card for the child, and then recording those things, recording the general examination, the the nutritional level and the weight of the child. And then you have to assess the growth and development of the child. You have to carry out physical examination, and also you have to provide health education to the mothers. So these are the general responsibilities or roles, we can say, as a nurse that we have in under 5 clinic. So under 5 clinic is a center where the promotive, preventive, curative, the referral and the educational services, these are provided to under 5 children under one roof. And these services are provided through trained nurses. So that is why it is very important for you to know that why you should take care of this particular age group, and why you should be more concerned about this group, and what are the care and services that is provided in the under 5 clinic. So that was all about today's topic. I hope you have got a better insight about the topic. Thank you.